Good morning, Chairman Alexander, Ranking Member Murray, and honorable members of the committee. My name is Dr. William C. Bell, and I'm the President and CEO of Casey Family Programs, the nation's largest operating foundation focused on safely reducing the need for foster care and building communities of hope for children and families across America. Casey Family Programs works in all 50 states, the District of Columbia, Puerto Rico, and the U.S. Virgin Islands, and with more than 16 tribal nations to influence long-lasting improvements to the safety and success of children, families, and the communities where they live. I thank you for the opportunity to be here today to discuss the disruption and trauma the opioid crisis is causing for our children, families, and communities. Data and our work with states and communities show that parental substance abuse is a key reason that the number of children being separated from their families and placed into foster care has been increasing significantly since 2012. As you've heard, approximately 270,000 children entered the foster care system in fiscal year 2015. Governors, mayors, child welfare leaders, nonprofit leaders, tribal leaders across the country have been working tirelessly to overcome the challenges they face on a daily basis as they struggle to support and strengthen the families impacted by this opioid crisis. Increasingly, challenges involving recruiting foster parents, providing treatment services, treating babies born with prenatal exposure, and healing the mental trauma experienced by families have left child welfare systems strained and challenged to target resources in the best way to help families in devastated communities. There should be nothing more important to our nation than ensuring the safety of our children and ensuring that they have the opportunity to grow up surrounded by a community of hope. I applaud this committee for its leadership and the passage of the Comprehensive Addiction and Recovery Act of 2016. Among its provisions, CARA strengthened the requirement that states have infant plans of safe care in place that address both the needs of the infant and the needs of their parents. This legislation and the Protecting Our Infants Act of 2015 make it clear that our national child family response systems cannot continue operating as though it is possible to fully address the well-being of children without addressing the well-being of their families and their communities. Current research has found that when parents can access treatment programs on demand and can enter treatment while keeping custody of their children, they are much more likely to become successful in completing that program and, more importantly, in continuing to improve their capacity to care for their children. One such example of an intervention is Kentucky's Sobriety Treatment and Recovery Teams program, or START, an evidence-based program that provides services to safely maintain child placement in the home and provide parents with rapid access to intensive addiction and mental health assessment and treatment. Kentucky START families have had twice the sobriety rates and half as many children in foster care as compared to their peers who did not participate in the Kentucky START program. Nationally, grandparents and other relatives are caring for more than 1/3 of all children who have been placed into foster care due to the parental substance abuse. Research on kinship foster care tells us that children who cannot remain with their birth parents are more likely to have stable and safe childhoods when raised by relatives. Frequently, relative caregivers have told us that the supports they need most include respite care, treatment, financial support, and mental health services for individuals and family members to deal with the enormous strain that this epidemic is placing on them. But most critically, we hear from parents, foster parents, youth, kinship caregivers, child welfare leaders, and tribes that prevention services that promote long-term sobriety, services that improve parenting capacity, and the availability of sustained services for families once children return home from foster care are among the most important improvements that we can make. But despite everything that we know that works to both keep children safe and support their families, the vast majority of our federal child welfare funds support a different approach. For every $7 that we spend on foster care, we spend only $1 on prevention. We must change how we spend federal child welfare funds to make sure that we're funding the efforts that are most likely to get the results that our children and their families need. We know it is important that we intervene as early as possible. States need the ability to target their existing federal resources into an array of prevention and early intervention services to keep children safe, to strengthen families, and to reduce the need for foster care whenever it is safe to do so. We also know that one of the most traumatic experiences that a child can have is to be forcefully removed from their family. In 2018, this committee will consider the reauthorization of the Child Abuse Prevention and Treatment Act. Casey Family Programs stands ready to be a resource to you and to assist this committee in any way that we can to reduce the impact of child abuse and neglect, to increase the availability and quality of prevention programs, and to increase levels of well-being in vulnerable communities across America. In spite of all the devastation that we have witnessed and all that you've heard from us today, I still believe that there's hope. And I believe in the inherent power that hope brings to those in need of help. And I also believe in the power that hope brings to those of us who have chosen to be the bearers of that help. We are a nation of overcomers. Throughout our history, when as a nation we decided that a specific challenge confronting us as Americans had to be resolved, we have always come together and found a way to be victorious. We have found a way to overcome every challenge once we truly decided that it must be done. This epidemic is no different. This must be done. Mothers and fathers and sisters and brothers and entire communities and tribes have cried enough tears. This must be done. This isn't a problem that people like Ms. Hagley or the Savage family and others in similar situations should be left to solve on their own. All of us together must face this challenge with them as a nation united. Federal, state, county, city, and local communities, making sure that every child has a permanent and loving home where they can thrive and grow up to live to the fullest whatever dreams they have for themselves. Thank you very much for this opportunity to speak with you today. I'm happy to answer any questions that you may have.
Thank you, Ms. Savage and Dr. Patrick and Dr. Bell.
Do you have some ideas on what we could do in addition to respite care, which you mentioned, to better support grandparents who find themselves in this unexpected role?
Absolutely. Thank you, Senator. And the effort that you and Senator Casey are approaching. You know, unfortunately, opioids is not the first time we've been in this position. I was in New York City during the crack epidemic, and we dealt with exactly what you're describing. And at that point in time, we called it skip generational parenting because of the loss of frontline parents, grandparents, and other relatives stepped in to care for children. And what we found was that they needed support groups, they needed financial support, they needed a navigator type program that would help them understand where to go. And one of the things that we created through the Department for the Aging in New York City during that epidemic was something that was called a Grandparent Resource Center, which was run through aging, connected senior centers and other community resources so that grandparents would not be alone or aunts or uncles would not be left alone to care for this child, but the community would be surrounding them. And I think that that's something that we could do in this situation as well.
Thank you so much.
What are some of the resources that communities need to prevent the need for foster care and keep children and their families safely together?
Thank you, Senator Murray. You know, one of the things that we've seen that we've spent a lot of time focused on the foster care rolls that have been increasing during the last 3 years. But in New York City, the foster care roll has continued to go down over the course of this time period. And I believe that one of the reasons that is there is because of the immense amount of prevention services that are available in the city. One of the biggest challenges for families who are raising kids and kids who are at risk of coming into foster care is social isolation. And if communities are going to strengthen their ability to keep kids out of foster care, we've got to make sure that families have the access to prevention services, that there are community-driven support services that are available to them, and that they're not left alone. Unfortunately, too many of our families have moved away from extended family and they're living in communities where they're set apart. We've got to create school-based programs. We've got to create support-based programs. We've got to create community-driven programs so that somebody can see every child every day so that that support is there. Because, you know, when you think about the protective factors, one of the 5 core protective factors is preventing social isolation and having community supports available for families. And I think that's what all communities need to strive to do.
Okay, thank you, and thank you for your expertise.
Dr. Bell, thank you for your work. You described the benefits of programs where parents have access to treatment and also don't lose their children.
Right.
And I wonder whether you could describe for the committee, from the point of view of families, a more typical experience in America today if you're somebody who has is struggling with opioid addiction.
I would hesitate to go typical because I know that our systems are in various levels of trying to figure out how to make this happen. But when you think about when a parent who has been reported for abusing a substance, so the START program that I talked about, the referral to the START program begins when a mother is, or an expecting mother, has tested positive either in the second trimester or the third trimester for a substance. And there is an immediate referral to child welfare. In many states, it has become prima facie child abuse and neglect to have a positively exposed child in utero. And we're working to help folks to understand that in that parent's mind, they are wrestling with a disease. And I like to do the comparison between what happened when crack was the issue and what we're trying to do right now in the opioid crisis. I believe that what we're trying to do right now is a much more humane approach to dealing with families who are struggling with a disease. Under the crack epidemic, that woman would have been referred to child welfare. We would have done an investigation. In all likelihood, we would have removed her child and placed her child in foster care. She would have been in the court system, maybe represented by a quality attorney, maybe not. Her child would have been languishing in foster care. She would have had a long list of things that she had to complete in order to get her child back, including housing, including parenting skills, including overcoming substance abuse treatment. But at the same time, we also know that stress exacerbates the use of substances. And we would be contributing to that stress by holding her child over here and restricting her access to that child. One of the things that grew out of that particular piece was that courts started to use drug treatment courts, which began to work in a conversation with parents to say, we know that you want your child back. We want you to have your child back, but we also know that you need to overcome this disease that you have. We will work with you to increase your capacity to see your child as long as you're working to achieve the sobriety that we know is necessary and you want to have. So I think that where we are right now is a mix of people who some states still say it's prima facie child abuse. We need to keep you away from this child. There are other states that are saying, no, this is a person who is wrestling with a very devastating disease, and we need to change our systems and protocols so that we can help lift them up. I mentioned earlier when I was responding to Senator Murray.
We're well over time, sir. We need,
Okay.
we need to go on to.
I want to start with Mr. Bell and ask whether you think having this information will help support these grandparents and relatives who are raising these children as a result of the opioid epidemic.
Thank you, Senator Casey.
Dr. Bell, I'm
Yes,
sorry.
thank you. Senator Collins did raise this before she left, and as I indicated, we are very supportive of what you are trying to do here, and it's something that we learned from the crack epidemic, that these grandparents need support centers, they need navigator programs, they need financial resources, because the notion of the $4 billion savings is because many of these grandparents have not necessarily been informed that they could become kinship providers. And I wouldn't advocate that we take all of these grandparents and bring them into the foster care system, because many of them can do better outside. But we do need to figure out a way to provide financial support, provide respite, provide opportunities for them to continue to live their lives so that they are not burdened down overly with these children. Because the one thing that we saw during the crack epidemic was that their health started to deteriorate when they didn't have the support that they needed. So I think that you're definitely on the right pathway and would fully support working with you on that.
Well, Doctor, I appreciate it because you bring particular experience and expertise to these issues, so we're grateful for that help, and it will give us momentum for passing the bill. So I appreciate that.
Thank you very much, Dr. Bell. Thank you for being here as well. One of the comments that I've been thinking about as I've been listening is the thought that shame and the consequences of one's actions leads many folks to hide the challenges and the addictions. I know that there's a strong push towards allowing parents who are going through treatment not to lose their children, which sounds like a good idea, but also a double-edged sword. Can you walk me through that as well?
So the approach really is one that says we want to honor your relationship with your child. We also want to acknowledge that having that child connected to you is a great motivator to overcoming the challenge that you're dealing with. But in doing that, we also acknowledge the need to make sure that there's constant monitoring of the children, that there is constant support for the children, that there's respite for the child, time periods for the child to be away from the parent, so that child welfare is not doing what we've typically done in the past, which is having this complete distance,
Yes.
but that we are not leaving the child just with the parent so that something might possibly happen. And we're continuously working with that mother and fathers and other family members to improve their capacity to care for the children.
Thank you.
Direct this to Dr. Bell, but Ms. Savage, if you have thoughts as well. I want to talk about what happens when a child hits the age of majority. One of the things we talked about in the Mental Health Reform Act of 2016 that this committee and this Congress passed is looking at HIPAA laws and how they may create barriers at age 18 for the parents to stay involved in the care of a loved one, a child who may have complicated comorbidities, addiction, and mental illness. We want to respect the privacy rights of adults, but we also want to make sure that if the doctor feels it's in the best interests of that child when they go from 17 to 18, that the parents can still, at the very least, know about when the appointments are so that they can help that 18-year-old stay on schedule. I just wanted to pose that question to you about how you think about making sure that families stay integrated in care when you have that transition to the age of majority.
You know, I think that it is important for young people, particularly entering adulthood, to have as strong a support system around them as possible. One of the things that we have wrestled with in the child welfare services area around privacy has always been being able to help the individual understand why this is helpful to them. And it's a very complicated legal matter in trying to override someone's right to privacy. But I do believe the relationship is the most important factor in getting people to accept that this is helpful to me as opposed to invasive to me. But we have to respect privacy, but I do believe that there's possibilities through relationship being able to get that done.
Great.
I'm going to ask you, Dr. Bell, how might we use data to estimate risk for children, and should we be using data from past cases in order to inform decisions about current ones?
Thank you, Senator Young. You know, I would just say about predictive analytics. We must first understand that it's a tool and not a solution unto itself. But predictive analytics is a very valuable tool that has been used for years in the healthcare field, in law enforcement, in meteorology, and it is essentially taking the things that we know, analyzing them to help us better predict the things that we don't know. And if we can utilize this tool that has shown so much value for others, aviation, I mean, airplane crashes, predictive analytics has been paramount to reducing those. And so I think that we have to explore every possible opportunity to do better for our children. And we believe predictive analytics is one of those things that we can explore.
Well, thank you, and I agree with you. Do we know the full extent substance use disorders are associated with the number of children being placed in the foster care system?
No, we don't, but we can.
Thank you.
And we can correspond on that.
All right. I look forward to that.
Dr. Bell, at age 18, do youth who have lost a parent face financial burdens in continuing their education?
They absolutely do.
Yeah.
And far too many of them do not complete their post-high school education, and far too many don't even complete their high school education.
You know, one of the ways that we try to take care of kids who's lost a parent is through the Social Security system. When a working parent dies, a child is eligible for Social Security survivor benefits, which are designed to help out in these kind of tragic circumstances. Until a couple of decades ago, Social Security survivor benefits were available for a child until they were 22 if they were full-time students. In 1981, Congress changed the rules and cut the benefits off at 18, even for students. The Bipartisan Policy Center, a group of both Democrats and Republicans, has recommended restoring eligibility up to age 22. Now, Dr. Bell, the average size of these benefits is about $820 a month. Is that enough money to make a difference for these young people?
Given the cost of living, it clearly is not. But I would say to you that there are a number of possibilities that we need to work on putting together to actually deal with this issue, because I don't believe that there's any single avenue that will solve this challenge that we're talking about.
But will it help us push in the right direction?
If we combine it with many other things that are possible, absolutely. And this is definitely a conversation I would love to be able to continue with you, because I think that it's pointing in a direction that we must go in.
Good, and I think that's important. You know, as Mrs. Savage testified, the opioid epidemic is not fair to anyone. And too many kids are also left to deal with the emotional and economic cost of losing a parent.
So, Dr. Bell, you've worked with school-age children your entire career. Can you speak to what more schools should be doing to help facilitate student well-being, especially in schools where children may be exposed to substance misuse in their homes or communities? And how can we here in Congress support those efforts?
Thank you, Senator, for the question. You know, I think schools have always been and should continue to be a core frontline institution in whatever ailments we're challenging in our communities. And I think particularly with the opioid crises, the school can become a very safe haven for young people. But as we know that there's a lot going on in our schools, and that means that we've got to change our approach that we're taking. I think that we need to focus less on the policing that we're doing in our schools and more on the protecting. And that we need to have conversations with the community, and that our schools should not close down at 3 o'clock. The schools have to become that school-based community center where our children and our families can go to get protection, to be safe, and to learn how to protect their lives and to improve the conditions that they're living in. And I think there's much more that we can do in that area.
Well, I thank you, and to both you and Dr. Patrick, one of the things you've both been talking about is the importance of integrated care and services and prevention that can come with that kind of integrated service.